As nursing students and eventually as nurses, there's a lot of things that we're going to have to deal with and just get over and move on with life. And unfortunately, one of those things is death. And with the COVID-19 situation that we found ourselves in, and with the civil unrest that's happening in South Africa at the moment, there's a lot more deaths that we're seeing at a rapid pace compared to general circumstances. So I've received quite a few messages from people asking, how do you deal with death, because it's so traumatic and it's a lot. I'm going to be giving you 6 tips on how you can deal with death. Just be aware that when you're dealing with death, it's a personal issue and it's not a one size fits all. First thing you need to realize is that death is inevitable. It's a process of life. Therefore, you need to be aware that it's going to happen a lot around you, and in some wards, it's more permanent than in others. For example, in your medical wards where you're dealing with palliative patients, you're going to see a lot more deaths than someone who's working in a surgical ward where it's patients that are coming in for surgeries and they go out, and majority of them are successful. So as a result, do not try to look for reasons of, oh, that patient shouldn't have died, or that patient, I could have done something better to help them. When we're dealing with death, we're always going to feel some form of guilt. Unfortunately, we cannot control all those things. We just need to make sure that we are doing our uttermost best as nursing students and nurses ultimately, so that the cause of the death of the patient is a natural cause instead of because of negligence and that sort of thing. The next thing is allow yourself to grieve. I think this is a big misconception that most people think that once you've dealt with death, you must just move on and go to the next patient. For some people, it does happen where they've wrapped a body, they've dealt with it, they've moved on, and they're going on to the next thing. Where with others, they need to take a moment to just breathe, to process the emotions that they're going through. We are all attached to our patients in different ways, and we all have different backgrounds, and as a result, that will affect how we react to the death of that patient. Please do not stay in that moment of grief where the whole day you're just going to be non-functional, because unfortunately we're in the medical field, we're going to be dealing with this on a daily basis. As a result, you need to be able to deal with your emotions in a short amount of time and be able to get back to being normal and being functional as a nurse. And I know that sometimes it's not fair, especially if it was a very difficult death that you just experienced. There is definitely a lot more things that you can do after your shift, but during your shift you need to deal with it quickly and move on. Please get the necessary help that you need. That could be in the process of talking to your other colleagues, talking to someone who's superior than you, having professional help by talking to counselors, your family members, just having a way to let out your emotions and be able to talk about it and be able to deal with it. Because if you keep it in, you're not going to know how to control those emotions, and as a result, it will come out negatively in other cases, where sometimes you might even speak rudely to another patient or to another colleague because you're still dealing with death and that sort of thing. And next thing I would like to say is, do not compare the way you react to a certain death with how everyone else is dealing with it. For example, a patient might die and one of the nurses might wrap the body, they do everything perfect, they leave that family and they go on and they're dealing with something else. Whereas with you find it more difficult to leave that body, or you find it difficult to leave the family because you guys have something in common, or you've got some attachment to that patient and that sort of thing. And we all deal with death differently. So as a result, every person in each death scenario, they're going to react differently. So therefore, if you're feeling overly emotional, do not think of yourself as weaker than everyone else, because they do not have the same reaction and emotions that you're feeling at that particular moment in time. And if you just happen to not feel any emotion towards that death, and it's just a process of life, but someone else is feeling emotionally overwhelmed, they're just really angry, frustrated and that sort of thing, don't think that you're above them because you're dealing with it properly and that sort of thing. We all have different attachments to different patients, and as a result, with each death that you're going to experience, you're going to deal with it differently and you're going to react differently. So as a result, take that into consideration, especially when you're speaking to your other colleagues. Don't make them feel bad for feeling a certain emotion, because you don't know, maybe that grandmother that just died reminds them of your own funeral with your own grandmother or with your own mother and that sort of thing, and as a result it brings back other emotions and that sort of thing. So please just be very much aware in how you react and how you're going to interact with others when you guys are dealing with the death scenario. And the very last thing is when it comes to dealing with the patient's family. So this is a very difficult one because you never know how the family is going to react. With some families, they will come in, they're all business, they want to get the forms out, they want the AFPOP team to take the body to the mortuary, get the funeral done. Some people will show no emotions whatsoever around you, and you might think they're being insensitive, but that's just how that family member is dealing with the death. Whereas on the other hand, the family might be overly emotional, they're crying all over the place, they screaming and shouting. Some might even start accusing you of killing their family members. You just need to be able to read the emotions that the family members are giving and be able to react in the proper way. If someone just wants to be a business, it's okay. Give them what they need, show them how sympathetic you are, and just move according to how they're moving. And if unfortunately the family members just overly emotional, counsel them as much as possible and obviously give them the reassurance that they need and help them to find ways to cope with the death. To end it off, I would love to say that it gets easier as time goes on, as you deal with more dates and that sort of thing. And with some people that is the case, especially with me. In the very beginning, I was very scared, I was frightened, I was overly emotional and that sort of thing. But as time went on, it became easier. I was able to read more of what's happening around the situation and able to keep my composure, get through the day, and then obviously deal with the emotions later on. Journaling really helped me to just get my emotions out there. And for me, prayer is a big thing. So sometimes I'll even just pray with the family or just pray with the body, especially after I finish wrapping it, and just letting go of the emotions and the attachments that I had to that patient. As the moral of the story of this thing is, find what works for you. I might give you all this advice, but they don't work for you. As a result, take what you can from this video and adapt it to make it work for you, because no one size fits all. We all deal with death differently, but as long as you're making sure that it does not affect your mental health, at the end of it, you are doing a great job. So if you enjoyed this video, definitely give it a thumbs up. It really shows YouTube that you enjoy these type of videos, and as a result, it can suggest this video to more people that would love to watch it. And if you haven't subscribed already, please definitely consider doing so. Until next week, Friday at 12 p.m. South African time, please stay safe, put on your masks, sanitize your hands, wash your hands, and keep yourself safe. Bye guys.